Hello, everyone. Good afternoon, and welcome to our weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Keisha Davis, who is a County Health Officer, Mr. Sean O'Donnell, Deputy Chief of Public Health Services, Dr. James Bridgers, Director of the Department of Health and Human Services, Dr. Earl Stoddard, Assistant Chief Administrative Officer, and our special guest today is Latonia Elrich, who is CEO of the Tree of Hope Association. Thank you, everybody, for joining us. And Mr. County Executive, I toss it to you. My accent is really heavy this afternoon. I've been talking Spanish all morning, so go ahead.
I think, well, I'll have my usual English accent today. I guess the Washington, D.C. accent, as it were. So first of all, thank everybody for joining us today. But before I begin, I just wanted to express my congratulations to Aisha Braveboy for winning the Democratic primary for the Prince George's County County Executive. And I look forward to working with her. I've known her for a number of years, and I think we're going to have a great relationship going forward. On things Montgomery County-ish, 5 years ago on this day, the Maryland Department of Health notified us that Montgomery County had the first confirmed cases of COVID-19 in the state. And all three of the cases were in Montgomery County and Montgomery County residents. I remember that day pretty vividly. We knew this virus was coming. I think everybody is sitting around for notification of the day when it would actually arrive here. But the reality of it hitting our community changed everything, and it did it pretty quickly. From that moment, we began mobilizing and pulling together our public health team and emergency response and hospital systems to prepare for what was ahead. I remember very well in the beginning as people were trying to figure out how does this thing spread itself and what are the vectors of spreading. You know, it did not take long to realize the only vector was people. And, you know, absent person-to-person contact or close proximity is very hard for the virus to spread. And that's why we made the very hard decisions to do the things we did in Montgomery County to minimize public gatherings and crowds of people, because we knew that to the extent that we can minimize public contact, we can minimize the spread of COVID. And we were intent on having as few cases as possible. And we were very intent on not repeating the scenes that we saw from New York City, where the people were pulling body bags out of apartment buildings and put them in trucks that were freezing people because they didn't have adequate room in the morgues. That was pretty alarming to look at. And for me, early on, it was one of those things where I felt like this is not going to happen here. And we took, I'd say, a very aggressive approach. And I honestly believe we saved many lives from the way we approached dealing with COVID. It became one of the biggest challenges we had. To date, we've lost more than 2,500 residents to COVID, 96% of which were over the age of 65. While many have moved on from the urgency of these early years, for the families who lost loved ones, the pain and the trauma just doesn't go away. Many people never had the opportunity to properly say goodbye to the people who died. And, you know, for a lot of people, it's meaningful to have those last moments together. And for people not to be able to do that had to be very painful for many people. Our thoughts remain with those families who lost members, friends, and colleagues through this. What stands out most from our response is how our county came together. Our employees, our residents, our health professionals, everyone played a role in keeping our community as safe as possible. We had residents who were actually making masks for us. It was very hard to get masks initially. And we were putting, you know, we still had frontline workers, police and fire, our doctors and health people, both in the county and in hospitals. They had to be on the front lines, COVID or no COVID. And without adequate protection and masks, it was a doubly challenging job. And so I was really grateful to the county residents who sewed masks for us and made it possible to give them to our employees. And I'm really grateful to the folks who worked with some of the Asian communities, particularly the Chinese communities, who had large quantity of masks delivered to Montgomery County that we could distribute to our workforce here and then to our residents. And I remember at one point we were actually had stockpiled enough that we were able to help hospitals out and another county out when they were running short of supplies. We put ourselves in a pretty strong position, and we maintained that all the way through COVID. We were not going to suddenly discover that we didn't have the supplies we needed. So I'm really proud of what we were able to accomplish, and the fact that we led the nation with some of the lowest death rates and highest vaccination rates among large jurisdictions. Couldn't have been done without the cooperation of people here. I always tell people how grateful I am to be county executive in Montgomery County, where when you talk about science and you talk about health, you're not dealing with masses of people who are just non-believers, who don't have trust in the medical system, notwithstanding the current Secretary of Health. It's just an amazing thing to be in a place where people take medicine and science seriously. While every part of the county government was involved in this response, I especially want to recognize our Department of Health and Human Services. Montgomery County is unique in Maryland. We're the only jurisdiction that runs our own health department. Every other county in Baltimore City relies on the state, but here we created our own public health infrastructure, and this goes back to the Duncan years. And during the pandemic, those investments we had made actually saved lives. The pandemic also forced us to confront longstanding inequities in healthcare. I remember one of the times I visited one of the hospitals, and they talked about how the patients were patients of the type they had never seen before. People were there for COVID, but they had other comorbidities that actually impacted the way you could treat COVID or impacted patient health. And it was a reminder that these people often didn't have any access to healthcare. And it was only the emergency of COVID and being near death that brought them into hospitals. And I think we learned from that, and we deliver our health services. I think we rely more now on our clinics and our partners than we did before COVID started. And we've really been able to focus on the most vulnerable residents. And it also changed the way we communicated with the public. We actually got, I think it was an Emmy Award for our commercials we did with Abuela, the grandmother image for the Hispanic community. We were recognized for those ads because the ads were effective, and they reached the Hispanic community to the point that the Asian and Hispanic communities were the highest vaccinated communities in Montgomery County. What we experienced 5 years ago still holds true today. Our public health system saves lives and builds a healthier and more resilient community, and we're going to continue to protect and support all of our residents. Speaking of trying to protect and support people, we have seen a decrease in fatal overdoses last year. They declined from 138 the year before to 83 last year. Today, our HHS leaders also have something positive to share about drug use in Montgomery County. We saw a sharp decrease in these deaths in 24. Overdoses involving opioids were down 48%, while deadly interactions with fentanyl dropped 52%. In the graphic we are sharing right now, you can see there were 83 overdose deaths last year compared to 138 in 23. This represents the lowest number of overdose deaths since 2015. For close to 10 years, we saw a concerning rise in deadly overdoses across Maryland and in Montgomery County. The county saw a 188% increase between 2012 and 2023. One of the main culprits was opioids, which accounted for 90% of all the intoxication deaths in 2020. 2021, we saw most with 142 deaths reported, and last year we saw fentanyl-laced drugs ignite new concerns about overdoses, especially among young adults and teenagers. We can attribute this reversal to many things, including education, awareness, and the proliferation of Narcan. Our Department of Health and Human Services played a key role in leading initiatives and solutions like our STEER program and the county's crisis stabilization room. And we did a bunch of community meetings, and if any of you had been in those community meetings, I think you would have seen the amount of pain and fear that was in the community, with parents just not knowing what to do with young people who were overdosing, and the sudden overtake of portions of our community by these kind of cases led to an awful lot of anxiety and concern. It's not over yet, and it may never be over. These things will probably be with us for a long time, but the level of it is starting to move down to a much lower level. And, our goal is to drive that level as low as we can possibly drive it. I'm going to stop now and invite Dr. Davis and LaTanya Rich to join us. And after that, we'll take questions from the media about this one issue.
Thank you, Mr. County Executive. It is, while we are very much encouraged by the decrease in opioid and overdose deaths that we've seen over the last year, we still don't want to take our foot off the gas. And I do really want to highlight the partnerships that have happened over the last couple of years as we've seen these increases. It really is the collaborative work of Health and Human Services, especially our behavioral health team, currently led by Chief Monica Martin and Dr. Rolando Santiago previously, Ben Stevenson of our prevention and harm reduction team, who he and his team have educated and trained thousands of people and distributed nearly 10,000 doses of Narcan into the community, which has a large part in helping to save lives and helping those folks see tomorrow. We had 83 people last year who didn't see tomorrow because of an overdose, and the benefits of Narcan, having that in the community, helping more people to be around, to have the chance of recovery. Partnerships with MCPS, the school system, with the police department, with Montgomery Goes Purple, with our treatment and addiction recovery providers. It really has been a collaborative effort to really get the message out about opioids, about fentanyl especially, that education. We have focused a lot in the first year around treatment and harm reduction with Narcan, and now as we move into the next phase, our focus is really on prevention and harm reduction. How do we get people to not use in the first place? And if they are using, how do we do it safely? How do we get them into treatment quickly? With that, I want to introduce LaTanya Rich and have her share. She is CEO and president of Tree of Hope and also helps to run our STEER program, which has been responsible for getting so many people into treatment, folks who may not otherwise have been connected. She has been a really strong partner in reaching out to our overdose community.
Hello, hi, I'm LaTanya Rich of Tree of Hope Association. We're the Recovery Community Center in Rockville. And I just want to say that I'm grateful to be a part of the Montgomery County network. We've been very well supported. Ben Stevenson played a vital part in ensuring that we became an opioid response program. So we've been able to give regular Narcan trainings, and we've had a lot of parents come in to get Narcan trained. Some staff from Montgomery County Public Schools, STEER, and our youth team also have played a vital part in distributing Narcan. I have Katie L here; she's on the STEER team, but they give out Narcan not only to individuals who have just had an overdose episode, but they also give them out to family members and loved ones. So it's been an amazing journey. I believe that Montgomery County has done a fantastic job in flooding the community with Narcan, which are saving lives, and as you said, Dr. Davis, giving people an opportunity to get it right, to get themselves together. And our peers walk with individuals for 6 months. So whether they decide to get it together, they're connected to something that can connect them to another opportunity to make a difference. And Narcan allows STEER in our youth team. We have a youth team, the Next Gen Pathfinders, that are in the high schools now, and they just started yesterday in a middle school, right? So they're working with the students and the family members to ensure that they have Narcan, they're educated, and that they have a connection to support on their recovery pathway in whatever way they're willing to pursue it. So it's just been an amazing journey. Our STEER's numbers are well over the national average of getting people engaged into treatment. And usually people, when they're initially engaged, they might not want to go to treatment, but because that's not a requirement of our program, our peers continue to work with individuals, and a month, maybe 2 months of engagement, that individual ends up in treatment anyway, which is the point, right? So both my teams have done an amazing job. Yesterday we had 15 kids from all schools from all across the county here for youth night. It was just such a good feeling, because it has been a journey engaging that demographic, but the gates have opened and it's really looking positive. Thank you.
Thank you very much. Members of the media, we are going to open it up for questions right now regarding these two topics: 5th anniversary of the first COVID-19 case in Montgomery County, and also the drop in fatal drug overdoses. Any questions regarding those two topics? No questions regarding these topics?
I see two people with beeping lights on. Is that something different?
That might be something different. They know to raise their hands.
Okay. I thought this was a new wrinkle on how people notified us.
No. Okay, so I guess we do not have questions regarding these topics. Thank you, Ms. Rich, for joining us today. You can remain on this media briefing if you like, but if you need to depart, feel free to do so. Mr. County Executive, other topics.
All right, on to other things Montgomery County-ish. In 2017, when I was a council member, I led the successful effort to get Montgomery County's minimum wage raised to $15 an hour, and then increasing by inflation after that. That was the second minimum wage bill I managed to get through the council. The earlier one raised it from the ridiculous federal level to about $11.50 an hour over a period of time, and then the $15 an hour minimum wage raised it to 15 over several years, and since then it continues to increase by inflation. And that's why at the beginning of March we've put out notice that the current minimum wage in the county starting on July 1st will be as follows. Large employers with 51 or more employees, the minimum wage will be $17.65. Medium-sized companies with 11 to 50 employees, the wage rises to $16, and small companies with 10 employees or less will have a $15.50 hourly rate. Consistently increasing the minimum wage is an important step that ensures Montgomery County workers can earn a fair wage that supports their well-being. As the cost of living continues to rise, this increase keeps workers and families closer to being on pace with inflation. It tends to be below inflation, and if you're living in the older apartments where we do have rent control, even that annual increase rate is below what's allowed in the rent control law for landlords. So people are still struggling to keep pace with rising rents. At the end of the day, a large part of the housing problem that is directly attributable to a substandard wage. There's housing out there that people could live in and, be secure in, but many of them don't make enough money to afford the rent, and too many of those people are paying more than half of their income on rent, leaving little money for everything else in a household budget. And I'll just give you an example. If a person earned $40,000 a year, which would be basically about what you'd make if minimum wage was $20 an hour, if they were a single person, they could afford $1,000 a month in rent. I think all of you know the odds of finding a $1,000 apartment in Montgomery County are slim and none. If they were a two household, they could afford up to $2,000 a month. Now, if they don't have any children, there are apartments they could afford, but if they have children and they needed a 2-bedroom apartment, again, the number of decent 2-bedroom apartments that are affordable at $2,000 is not a whole lot of Montgomery County's housing stock. It is a challenge to live here if you're living on low wages. And I think all of you get that. I know many of the young reporters out there are not actually making a fortune. They can appreciate the struggle to try to live in Montgomery County. it's time that we begin considering aiming for a higher minimum wage. I would like to get us to the point where we're up to around $20 an hour and then increasing by inflation. As we've witnessed over the last 8 years, living expenses have dramatically increased. So I do think we need to look at a higher minimum wage in the county, and I hope the council be willing to participate in discussions about how we get there. This morning, I went to a Montgomery County Stakeholders Forum hosted by our Department of Permitting Services. Department of Permitting Services, we call it DPS, plays a vital role in keeping projects moving and supporting our local economy. Today, innovations and technology improvements and customer service enhancements will work to help customers complete projects faster. From online permitting tools to in-person support in Wheaton, DPS is focused on serving the public better. They've launched new GIS maps to improve access to property information. The new e-solar program has helped homeowners get panels on the rooftops faster, while updated guides have helped restaurants open sooner. Plus, the new permitting dashboard provides transparency around planned review timelines, so projects are no longer stuck in limbo. These are all changes the business community asked for. This started, during my first year as county executive. The year before, when I was on the council, I made an agreement with Sydney Katz, who was a council member along with me, and Sydney was the key vote in getting the minimum wage passed in Montgomery County. In return for which, I said, look, let's go out and do a tour of small businesses in Montgomery County and let them tell us what they're experiencing that's making their life unnecessarily expensive or unnecessarily difficult. And Sydney and I did a series of, I think, 6 community meetings, and I had my managers come from the departments, and we began changing things very, very quickly, whether it was procurement regulations or whether it was how inspectors treated, how they did their inspections. We've been on a path of continuous improvement. And when I brought Robbie over from Rockville as the new permitting director, he brought a lot of the innovation and the ideas he had in Rockville to work here in Montgomery County. And I was really happy to get him here because I had heard a lot from the business community about how good Rockville was and where they thought Montgomery County would do well to emulate some of Rockville's practices. So getting him over here, his leadership has helped transform that department. We're still on a mission of continuous improvement. We don't know what to fix unless somebody tells us they've run into a problem. But I can tell you that the attitude now is very different than the attitude that used to be. People, if they're having problems understanding a regulation or if they, fail, an inspection, they're getting a lot more help. They're getting help early in the process, but they're getting more help when they get something wrong. So this does not become a guessing game and they can actually move faster through the process to make sure that what they're doing meets code, and to do that with the least disruption possible. So I really want to thank them for the work they're doing in DPS, and Robbie for his leadership there, and for all the people who turned out this morning, virtually and in person, because theirs are the comments that will help us continue to make improvements in the system. What I tried to emphasize for the audience is please talk to us. If you're unhappy about something, you experience something that doesn't feel right, seem right, or maybe you think it's not the best practice, talk to our people, because the only way we can fix things is when somebody says, I tried doing this, it's not working the way it should, would you take a look at it? So if you have things you want us to look at, our departments are more than willing to look at them. We want to be the best at this, and that's a big goal for us. I think finally, I just want to talk about, we're almost finally, I want to talk about some of these housing proposals that are out there now. I want to make a few comments because there are more than one proposal out there, some of which are from the planning board, and most recently, the More Housing Now package of proposals. There are things in More Housing Now that I don't have any problem with. I think expediting the permit process to go from an office building to a residential building ought to be really simple. If you're staying within the permitted height and density guidelines, you should be allowed to make that conversion with the absolute minimal, amount of red tape, mostly just making sure that whatever you do to your building complies with building code. And I do believe we need to look at workforce housing. We have a workforce housing program. I don't know why they referenced it as the first workforce housing program they were creating. We have one. The problem is it doesn't work. It's rarely used. And so our staff has been working on a set of recommendations for the council on how to change that program so it's actually effective. So hopefully we can come to some agreement on how to make changes in our workforce housing programs that'll actually help more people in Montgomery County have both rental and home ownership opportunities. And I look forward to making progress on that. But there are parts of the ZTAs and with the University Boulevard Corridor Plan that are a problem. And these processes basically throwing out community planning. For all the talk about Thrive, I'll give you an example of a neighborhood in Four Corners, right across the street from Blair, where they had meetings with Park and Planning, and then Park and Planning in the last meeting brings out their proposal about what they want to do, which is basically rezone about a third of the neighborhood, not just for duplexes and triplexes, but for commercial mixed-use buildings. And it's a ridiculous place to put it. God knows, given the lack of retail demand in general, there's not a high logic behind putting a lot of commercial into some of this, but it totally disrupts the neighborhood. And people, I know a lot of people. I know council members who talked about the great house they lived in and how they looked for it. I mean, people do a lot of work and they make the biggest investments in their lives in the houses they live in. And people want neighborhoods, neighborhoods that have trees and are, quiet and don't have heavy traffic on the inside of the neighborhood are really highly desirable things. Montgomery County has a lot of great neighborhoods. And the idea that the neighborhood zoning can just be thrown out without going through a master plan process is just counter to everything the county did in building up the kind of housing and neighborhoods that we have today. And the processes that we used to have were far more robust and provided far more opportunities for community engagement. I was actually appointed by Doug Duncan to the Silver Spring Sector Plan Committee that actually reviewed. It was citizens with different opinions, not everybody thought the same way, along with businesses and developers who sat down and did the plans and came up with agreements that advanced everybody's interests. And it was one of the great experiences that you could put different people with different opinions in a room with the understanding that change is somewhat inevitable. So let's figure out how to create the best changes. Planning board's completely moved away from that. We voted on things. We voted on the recommendations that ultimately came to the board and the council. Nobody votes on the things that the planning board is putting out now. In fact, more often than not, when they tally up the letters in response to their proposals, the negatives outweigh the positives, but that doesn't dissuade them from doing what they're doing. These plans, including the corridor plan, really symbolize this abandonment of master plans. And it's something that really concerns me. And it concerns me because, for other reasons, this is being done without any of the things you would normally do in a planning process. The more housing now takes many miles of roadway in Montgomery County, rezones all the housing along the side of the roadway. Technically, as the sponsor would say, it's not a rezoning because it's still R60 zone or R90 zone, but it changes what you can do in the zones. And a lot of this is going to create projects that don't work. There is no guarantee, for example, that if you have an R60 lot, which is 60 feet wide, that somebody's going to build a triplex rather than a duplex, because the lot coverage issues. Duplexes will probably be far more profitable. And the thing about a duplex versus a triplex is if you build duplexes, there's no affordable housing requirement. There's no requirement for MPDUs, and there's no requirement for workforce housing. So there's nothing in this bill that guarantees that any affordable housing will be built. And so the amount of affordable housing built is likely to be not very significant. There's no way this is more housing now being the operative word. If you picture every house along George Avenue or Connecticut Avenue or University Boulevard or Veers Mill Road, each one has an individual owner. unless every owner on a block decided to sell their housing to a developer, you would have individual owners deciding to build duplexes or triplexes on their lots. There's no design standards. There's nothing in this bill that requires some kind of conformity to anything other than setbacks. And so this is an invitation to probably the most disorganized development Montgomery County has ever seen. There's no involvement. Nobody went to our housing department. If they had gone to the housing department, they would have been told that we're working on changes to workforce housing because it doesn't work. There's no consultation with transportation. There's no conversation with environmental protection. One thing that's pretty clear about the designs we've seen, it would be very hard to manage on-site stormwater collection in any kind of triplex on an R60 or R90 lot, which means that if you can't collect the stormwater there, it's in the street. And if it's in the street, our pipes can't handle it. And changing our stormwater structure is not cheap. You literally have to go into the ground, dig out the pipes, and redo the pipes. And the problem doesn't stop in front of the house because whatever additional water comes in upstream flows downstream. So if you increase the load upstream, you're increasing the load downstream. None of this was taken into account. And there's no estimate for infrastructure costs. So to do all this stuff without any of the things you normally do in a planning process is just going to make things worse. But it's not unlike what they did with Thrive when the county had to present to the council on Thrive. This is the previous council, so I'm not saying this council. When they presented to the previous council and told them what the infrastructure would cost, they were just greeted by Hans and Casing saying, "We don't believe that." So that's an objective, rational analysis if ever I heard one. I'm not believing something. That's a fine thing to do as long as you've got evidence that there's reasons not to believe in it. But if you just simply dismiss it because it doesn't fit your narrative, that's not a very good reason to not believe the information you're given. These things don't look at specific communities. There was no consultation with any community about what they're doing. It doesn't address parking. It doesn't address the traffic impacts. There's a lot of this that's just flat out being left out. In contrast, Montgomery County's part of their history of decent zoning was we have all these master plans. We have a timeline of building, not even building out the master plans, but we have a timeline for what park and planning thinks will be built in Montgomery County over the next 30 years. It runs, the current round we're in, called Round 10, runs from 2020 to 2050. And it is park and planning's estimate of how many units are needed on 5-year increments and how many which is based on the number of jobs they think are coming here. You wouldn't know it, but there are 30,000 units that are already approved that aren't being built. And they're all in master plan communities, which were intended to grow. So no one's looking at why they aren't being built. It is deciding we'll just provide different opportunities to build elsewhere. These smart growth communities were tied to jobs. They were tied to opportunities to locate jobs and housing close together, and they were closer to transit. These are benefits that do not occur when this stuff is spread out over roadways in Montgomery County. It kind of makes the worst parts of sprawl even worse. These were things that the county used to be proud of. When we were doing our zoning, we talked about how we're building all these smart growth centers. So to walk away from the smart growth centers and the plan of growth to concentrate future development in those centers and say, we'll just put it along all these roads is a real disservice to the planning that was done before, but it undermines even the smart growth centers. Smart growth centers are supposed to have a mix of housing. We already know that if these duplexes and triplexes are built, most of the housing is not going to be affordable. It's going to be market rate housing, which means those market rate units that otherwise might have wound up in an activity center are going to wind up along Georgia Avenue. And if they're not in an activity center, the activity centers won't have the diversity of housing. That was one of the goals we were trying to achieve when we created the activity centers. Meanwhile, the council's the Office of Legislative Oversight issued a racial equity and social justice impact statement. And the highlight of it was this plan will widen disparities in housing by race and equity. So this would be the second time. If the council ignores this, they did the same thing with Thrive. They were told that Thrive ran the risk of increasing inequities and racial disparities, and they disregarded it. They would not even give the company they hired to do the analysis of racial equity. They wouldn't even give them enough money to complete their study. They just simply dismissed the outcome of the study. If you could do racial equity studies, you probably ought to listen to them and pay some attention to what you might learn by the study, but that apparently is not something that we're doing now. So I have more specific comments and suggestions going forward, but I did want to encourage residents to engage in this. I'm very concerned about this approach, and I participated in the process when I was a community activist. We did good plans, and we didn't have to cut residents out of the process. There seems to be an attitude that if we involve residents, somehow nothing is going to change. You can't look at Montgomery County over the last 30 years and say nothing changed because of our involvement in the residents. Lots has changed, and we can make decisions better as a community than we're going to do them if we do them on a standalone basis. Tomorrow, the planning board is going to have a hearing to review More Housing Now package. Next Thursday, the county council is holding 2 public hearings, one in the afternoon and one in the evening. And I encourage people to engage on these proposals. People need to hear what you think. Finally, earlier this week, I had a lot of fun. I got to go to Central Nia and Silver Spring to read 2 books to a group of 3 and 4-year-olds in Central Nia's Child Care Center. And it's a really wonderful program. And it was great to see all these children engaged, talking, being able to answer questions, focused on listening to reading of a book. I had a blast, and it left me with a smile on my face when I left. Their joy and engagement with this book and being read to was a reminder of how important reading is to young children. It helps develop their minds and their learning skills. We have an incredible library system with thousands of books for kids of all ages. We continue to invest in reading resources and supports in MCPS, including the county's pre-K education infrastructure. I want to just emphasize something that I've been saying, and I know most teachers and most education professionals would agree, of all the investments that we can make in early childhood, or just to say all the investments we can make in children, getting children into universal pre-K would probably be the most powerful and most effective program that the county or the state could create. The more kids that get into pre-K and the more kids that go through socialization, the kind of learning experiences, early learning experiences that these children get, leaves them in a position to enter kindergarten on grade level with other children. Right now, we continue to hear that many of the kids entering the school system are 2 years behind. I want you to ponder for a minute what it means to be 5 years old and be 2 years behind. That's like having a 3-year-old in your class instead of a 5-year-old. Any of us who raise children know there's a difference between a 3-year-old and a 5-year-old. The fact that this kind of program can make sure that kids enter school on a level playing field has lifetime changes and outcomes for those children. It actually makes a difference. It makes more difference than pretty much any other intervention that you can possibly do. So I'm a big believer in expanding childcare. I hope the state continues to make those investments. We're going to continue to try expanding it even further. But we ought to take some comfort that this is actually a problem for which we know the answer, if only we could marshal the resources to be able to do it and do it quicker. At this point, I'm going to turn it over to my HHS team for their updates, and then we'll take more questions.
Thank you, Mr. County Executive. We'll keep it brief. Flu continues to be elevated, but is started to drop. COVID is low. RSV continues to be low. I do want to just highlight measles because that is something that has been in the news. We have not had a case here in Montgomery County, Maryland. I'm going to knock on wood. We did have a case, folks might remember last year, February of 2024, there was a single case of measles in the county, and want to thank our disease response team that was in a single unvaccinated child. And it didn't spread, and it didn't spread because the broader community is largely vaccinated, and the policies that we have here in Maryland that require vaccination in schools, both public and private schools, unless there's a medical contraindication or religious exemption, are one of the things that help the community be healthier. We know, we learned from COVID and many others, that when the community is vaccinated, when the community is healthier, we all benefit from that. I also want to recognize, I joined as county health officer in December 2022, and I want to recognize Dr. Bridgers and Sean O'Donnell, who did much of the yeoman's work of leading this county through COVID, and Dr. Bridgers serving as acting health officer, and Mr. Sean O'Donnell, who is here affectionately known as Mr. COVID, just recognizing them for their service and all that they did to help keep the county healthy. We'll turn to them.
Thank you, Dr. Davis. I have no updates. Mr. O'Donnell?
I have no updates. Appreciate the kind words. Also, want to recognize Dr. Gales, who was with us for much of it, and Dr. Stoddard, who also provided a lot of support to our response during that time.
Yep. Ditto.
Dr. Stoddard, do you have any remarks today?
I was going to do something a little unusual, and I want to, because I've gotten a lot of questions about this, and I'll let Dr. Davis answer the question I'm about to ask. But I've gotten some questions from people saying they're traveling to the Austin area where the measles outbreak is ongoing, and they were vaccinated as kids. Do they need to get a booster or anything of that sort? I think I know the answer, but I'll let Dr. Davis, who's the medical expert, answer that question just for the benefit of others.
Sure. So if somebody is born in 1957 or earlier, you are considered immune. You probably had it as a child or were exposed to it. So those folks we aren't worried about. Folks who were born between 1957 and around 1968, you probably want to check with your physician and potentially get your titers checked. The vaccine that was given during that time isn't effective as the vaccine that was given later. So those folks may want to consider getting their titers checked or consider getting a booster. Folks after that time period are mostly safe if you've gotten the two vaccines. So school-age children should have gotten that. One other group that we want to think about are those who are considering getting pregnant. So once you are pregnant, you cannot get the MMR vaccine because it's a live vaccine. But for women who are considering pregnancy, you may want to consult with your doctor to make sure that your antibody titers are sufficient and could potentially need to get boosted before you get pregnant. So thank you for the question.
Yeah, and I think I think the numbers from post 1968 is adults in that span. I think it's more than 95% maintain a robust titer, and in some analysis they've done. So, but yeah, I just want to. I've gotten several questions from friends and others who are traveling to the area of the outbreak in Texas, and they were just inquiring and wanted to make sure we could address that for anyone else out there who may be doing the same. Otherwise, we're open for questions, I think.
Thank you. Members of the media, any questions at this time? Oh, there's Judy first from the Greater Olney News. Good afternoon, Judy.
Good afternoon. Mr. County Executive, I was at that meeting or that press conference on March 6th of 2020, and you had said at that time that the county had been preparing for the coronavirus since, I think, January of that year, and that there probably wasn't a great risk to the community at large at that point. And even Council Member Katz said that we want to make it clear that this is not a crisis. And within what seemed like hours, it was a crisis. Are you still surprised and shocked at how quickly this developed into the crisis that it developed into?
I was surprised about how much of it managed to get into the county. I mean, it's one of the things about being a county that's very cosmopolitan and has people in and out from all around the world. We had lots of different potential points of entry, and it was very hard particularly initially, to really contain something when you didn't know who was getting off a bus or a train or a plane and going to be eating in a restaurant or meeting their friends and beginning to spread this. So it was kind of alarming how quickly it ramped up. And I remember that early on, not only were we first, but for a while we had the most infections in the state, which kind of fits with a community that has lots of people coming and going. It was after, as that was emerging, is when we began just clamping down on everything. We had the mask mandates. We put capacity limits. We closed, businesses so people couldn't be in the same place at the same time. We did a lot of stuff that we knew would, the one thing that could control the spread of COVID was breaking the chain between one person and another person. So sort of like the less human contact there is, the less ability of the virus to spread. And so we made those decisions, pretty early. And I'd say we did them to a greater extent than a lot of other jurisdictions did. And I do believe that that it really made a difference. But I was not happy watching in the beginning. And like I said before, when I saw those pictures from New York City, it just kind of implanted on me that there's no way we can let that happen here. I mean, I just could not imagine people going into apartment buildings and taking out dead people. And I just said, we need to make sure this cannot happen. So we did the right thing. Travis Gales was amazing, despite all the nonsense he got from the haters. He stood by his decisions, and I made it very clear to him that whatever he thought was the best medical advice was going to be the medical advice that we would follow. And I really appreciate everything he did to get us through that, and was sorry to see him go. But I, always felt like he was really pretty brave in the face of criticism from the state and criticism from people here of a more conservative ilk who didn't like what he was doing. He stuck with what he should have been doing, and I really, really appreciated it.
Thank you.
Thank you, Judy. Mariam Shahzad, Montgomery Community Media. Good afternoon, Mariam.
Good afternoon. Thank you. County Executive, on the More Housing Now, do you think the council should modify the package? Do you think it should be pulled? What do you think should happen?
I think it should be pulled. I mean, I think in general, given what's happening with the federal government and uncertainty about who's going to have jobs and what's going to happen if they don't have jobs here, this county could very easily wind up with a whole lot of empty houses. If you think about it, between the threats for deportation and the real job loss, I mean, people aren't going to be able to afford to stay here if they don't have jobs that can, pay for the living right now. And so, since we've got so much housing that's ready to build, and we've made no effort to figure out why it's not being built, and we've got the opportunity to see what happens in terms of how our population shifts or doesn't shift, there's no need to do any of this stuff right now. And to me, I'd rather be focusing on how do you build out the master plans where all this stuff was planned for, rather than trying to do something completely different. So if it was me, I'd pause it, and I would take the other thing I meant to say this. The planning board zoned for all these other housing units. So if they zoned them in a way they think is inappropriate, and we're talking about places where changing them doesn't involve going into anybody's neighborhood. This is about shopping centers and low-level development that can be reshaped, which is mostly how we've done our growth here. They could go back and look at all the master plans they passed that have been largely unbuilt so far, and they could say, are these the right housing types here? Should we change these master plans? Would these master plans get built if we built what we think is the kind of housing that people want instead of what we put in there before? It would be more effective, less disruptive, and still stick true to the plan of trying to focus development around smart growth centers. They could do that tomorrow, and it would cause little disruption And if they're right about housing types, this is a perfect place to try these different housing types. The fact that they're focusing on older communities, they're looking at, for example, if I start displacing people on University and Georgia Avenue, the people who largely live in the houses on the road are minority people. And many of them aren't owners, they're renters. So the focus of a lot of their housing new plans continues to be a focus on moving out people who are minority and lower income renters to make way for something new and better. That is not a good plan. I think that's why the Council's on Racial Equity Office looked at this and had the feeling this may actually exacerbate racial disparities in the county. So I wouldn't do anything with this thing. I would put it in a box. I'd look at what we could do I'd look for how we could fund more affordable. I'd invite their cooperation in figuring out how we change workforce housing. We're talking about targeting development on certain employee groups in the county who find it hard to live here, but provide a lot of essential services here. I think nurses, teachers, a lot of people in those kind of middling income ranges. There's a lot we could do, but it requires actually kind of thinking together and working on it rather than throwing out solutions, and particularly saying that you're going to get more housing now and that it's going to be affordable. Like I said, when a person could simply build duplexes and never create a single affordable unit. So that's kind of how I feel about it.
Thank you so much.
Thank you, Marianne. Members of the media, any more questions for the county executive and or officials this afternoon? No more questions? Going once? Twice? Okay, I guess we're done for today. Thank you everyone for joining us. Have a great and safe afternoon. We'll see you next time. Bye-bye.
Take care.
You're talking to especially the businesses, the restaurants and what. Yes, we're talking to them about how this is what can happen when the person comes to you.